Good morning, I'm Ferdy Salvador. Welcome to Industry Beacon, where we shine a light on the trailblazers, the disruptors, and the leaders shaping our future. And in each episode, we explore how they're staying ahead in their fields, one industry at a time. This morning, we take a look at the rise of aesthetic medicine in the Philippines. Just recently, Clinique de Paris celebrated a decade of pioneering work in hair restoration. And how's the demand like? As well as the competition. We are now joined by its founders and managing director, Ludovic Branellec. Also with us is the Dr. Rafael Fortus, medical director at Clinique de Paris. Good morning, guys. I should say Clinique de Paris, like
Good morning,
the proper way to say it. Thank you so much for joining me this morning. And this is a very important subject, gentlemen, especially for people at my tender age of 35. And there's a lot of taboos and, how should I say, a shroud of fear concerning hair, right? But before that, how did you both put together Clinique de Paris? Ludo?
Well, I would say Clinique de Paris is a message of love, was built on love, love for one another, love for the Philippines and for the Filipino people. So I guess we really wanted to bring to the Philippines the best available techniques in terms of hair restoration.
But you weren't in the hair industry in the beginning. What were you doing?
Absolutely not. Actually, I come from hospitality background, so I used to, after growing up in the Philippines, I studied in Europe hospitality, so I always worked in hotel and restaurants. So completely different industry. When I decided to move back to the Philippines, I wasn't really sure if I was going to venture into the family business or do my own resort or restaurant, and I was lucky to be exposed
Well,
to
your family is also in the beauty side, but then the accessory side, but let's not talk about that this morning. What about you, Dr. Raf? What were you doing before Clinique de Paris?
Yeah, so I'm Filipino by heritage, but I did all of my training in Australia. And so we get to combine the best of the best. Everyone knows that France can bring luxury products, and that the Filipino nurses and the malasakit is really what makes us really good. Yeah. So by combining the two together, it really becomes a very competitive force.
Right, but you don't study to be a hair doctor in medical school, am I correct?
Like all things, it's a bit of luck and a bit of persistence. So I fell into hair and aesthetics because of an incidental exposure.
Tell me.
Yeah, so I was traveling around the Philippines looking for opportunities to work, studying in Australia and finishing my residency, and then had the opportunity to train in Paris. So hence the name Clinique de Paris, combining the best of the three worlds. So I love hair because it's really the combination of art and science, working with your mind, working with your hands as well.
Right. You know, okay, I said earlier during your intro that, you know, it can be a touchy subject, like especially me. You know, I'm gonna say it in public, I'm losing hair. And a lot of people don't actually say that. I mean, you know, it's a shameful thing for some people. It's depressing for some people. It's also confidence degeneration for some people. And, you know, for us that are normally on camera as a form of living, you know, it's quite important for us to look the best we can. And there's a lot of things that obviously factor into hair loss. But in the Philippines, we're not as exposed compared to other countries as a top hair place to go to. You're talking about Turkey, you're talking about the US and other parts of Europe and even Australia, right?
Yes.
How has the industry grown in the 10 years since Clinique de Paris was operating?
So absolutely, you know, hair is really the forgotten corner of aesthetics, where people know about skin and body care products, but hair is actually, you know, a signal of your gender affirmation as well as your status, your mood, your general wellness. And when we go to important events, it's usually the hair is the one thing that we check.
Yes.
So when it starts to fall, so too can a person's self-perception. So we are giving permission to men and women to really understand what options they have. Modern medicine has come a long way in the generations before us, that people for the first time can choose when or if at all they lose their hair, and
Right.
that can be very empowering for them.
Right.
So we start with a clinic that's very welcoming and doesn't feel like a medical facility, and just having that patience with and the privacy of the patients as well.
I don't know if you have this data, but genetically in the Philippines, do we have a percentage of men and women that lose hair at a certain age? When do you start to lose hair?
So hair loss, genetic, is the bulk of male pattern hair loss. So
Okay.
it can affect up to it's the 90% cause of most hair loss. Okay, so for most
Genetics, 90% of hair loss.
in men, and
In
for
men.
women it's about 50%. So about half of all men will experience some hair loss,
Yes.
and about 40% of all women. So a lot of these
In
patients,
general?
in general,
That's a very high statistic.
yeah.
Right, but like Ludo, like here, I mean, in the Philippines, obviously, or around the world, I'd say, if you're a male and you lose hair, it's more acceptable, right?
Absolutely.
But for women, it's absolutely devastating, right? Do you have a lot of female patients in the clinic?
Actually, yes, you'd be surprised to know how many women experience and suffer in silence. So use all sorts of techniques and hairstyles to cover their hair loss.
Right.
Some can be genetic, some can be connected to postpartum, or could also be caused by hairstyles like traction
Right.
alopecia.
But in general, what age do you start losing significant hair?
It can really depend. Some as early as their late teens, which can be quite impactful on their lives.
1,000%. Yes.
Exactly. But in general, between the ages of about 25 to up to 65. And it comes at all stages of their life. So
Yeah.
we're so happy to kind of help people at their college days to really the beginning of a marriage to the end of a marriage and a new lease on their own life as well. So that's what's really rewarding for us.
Right. You know, it's funny because sometimes on social media, I see, funny memes about people in an airplane coming from a certain country, and all of them have had the treatment, right? Do we have what are the kind of treatments a patient, men and women, can subscribe to prevent hair loss or to restore hair?
Yeah, so like all things in medicine, prevention is better than a cure. So starting early with the right medical advice, not Dr. Google, but really seeing a professional
Guilty.
that focuses on hair. And
Yeah.
there are options that you can apply topically to medical treatments inside a clinic, and surgery can be relied on once it's either advanced or you need something a bit quicker.
Right. Some men are also afraid to do medical treatments when it comes to hair loss because there's a myth, I would say, or maybe in the past 10, 20 years, that if you take medicine for hair loss, you lose your virility. Is that a fact, or is that a...
Well, I guess, yeah, that's correct. There's a slight percentage, I would say 1 to 2% of men who could have some negative side effects.
Right.
But in those minor cases, after 2 weeks of stopping the medication, you're back to your normal state. So I always say, give it a try. Some people are allergic to aspirin or paracetamol, and I guess there's less risk with topical medication in terms of long term.
And there are lots of different options, not just the medicine. So our job is to inform and educate the general public about what options they have, and their role is to decide what they want for their body.
What
and
is
when.
the top, treat me now option? Surgery?
For instant results, hair transplantation is very safe, it's very effective, the downtime is a lot quicker than before, and the results are better than they've ever been. So for the instant results, it's a hair transplantation with 1 to 2 weeks of downtime. But there are medical therapies like plasma, which is rich in growth factors, and new molecules that always emerge, like exosomes and other proteins as well.
Right, but okay, for example, I'm going to your clinic tomorrow, okay? What's the fastest, most effective? Is it hair transplant surgery?
I would say the DHI, which is direct hair implantation. So
Okay,
this is building
and
on-
where do you get this? I heard that obviously if people go, if they lose hair, I don't want to use the B word, okay, because we're not using the B word, but they get from the back of their hair, the head, and because you don't get bald here.
That's right.
I use the B word. You don't have hair loss here.
So hair loss at the hair at the back is actually immune to the causes of hair loss,
Okay.
which is mostly hormones.
Okay.
So when you take these hairs and you place them anywhere else onto the scalp, they remain immune for the rest of your life, and that's the simplicity and the sophistication of the hair transplants.
Okay, so do people still get like a piece, like a line here and then transplant it? That's the surgery bit,
That's
right?
the strip technique, I would say, where they would get a flap of skin from the back of our head and then stitch back the donor area to re-implant this hair.
Does
on the
that
front
still
of it.
happen nowadays? No more.
Well, the problem with that is that you can end up with a scar and can't have a short haircut.
You don't practice that.
No, direct hair implantation is really one at a time. So you
Okay.
take the hairs individually, implant them individually, almost like creating a tapestry each day.
Right.
So there's an art form of how you place the hairs, the angle, the direction, the position, the puyo or the swirl at the back of the scalp also
Right.
dictates the grain.
Right. You know, there's a myth in the Philippines when you have two swirls or two puyos, you're supposed to be a naughty child. Just putting it out there. What are the latest techniques that the hair transplant or the hair growth industry is now employing, aside from exosomes, as you said?
Yeah.
Yes.
So like all things in medicine, hair science is advancing very, very rapidly.
Right.
From AR to AI, and even some robotics are getting involved. At the moment, the nuance and the precision of a surgical hand is still at the forefront, so we combine that with the best technologies and medicines as well.
What about, okay, if there are patients that obviously have gone through, let's say, dialysis because they've got diabetes, unfortunately, and they do lose hair, you know, especially the eyebrows. Is there a way to implant that as well?
Yeah, so 90% of hair loss is genetic,
Okay.
but for those with a medical cause, they can see one of the doctors and they can identify if they are reversible. But of course, hair can be implanted not just onto the hairline, which is the most popular, but also onto the eyebrows, which is very auspicious, and also onto the beard, which is very popular here in the Philippines.
Really?
Yes.
Okay, but Doc Raf, we're gonna go back to that after this. We're gonna take a quick break. Industry Beacon will be right back. Stay with us here on the Billionaire News Channel.
Good morning, I'm Mikey Oreta, and you're watching Basis Points, where we dive deep into the numbers and the stories that drive our economy and shape our world.
Stay ahead of the curve with the latest on financial dynamics.
The Philippines' trade deficit hits its highest level in over 2 years. The Philippine stock market continues to plummet. The Philippine Economic Zone Authority is on track.
Join us as we delve into the evolving economic landscape. Mikey Oreta, Basis Points, 9:30 a.m. Only on BNC, the Billionario News Channel.
The latest news, national issues, the political scene, and conversations with prominent personalities. All these firsthand at the forefront.
Is still continuing with hearings on the EJ.
Filing
We
is
can
that-
recommend the filing of cases with the proper offices or agencies.
It is always victimizing the poor, so we will continue to go against corruption in the budget.
At the forefront with attorney Karen Jimeno, 8 a.m.
Ito po si Father Nono.
Ako po si Father Fiel Pareha.
Ako si Risa Singson Kaupeng.
Kape at pandasal na po tayo. Ito po si Cardinal Chito Tagle.
Definitely, competition will be much stiffer because while we have the six, you have Maya Bank, we have Uno Digital Bank, Uno Bank, GoTime, Overseas Filipino Bank, and of course Maya. But of course, GCash is not a licensed digital bank player, and having to have another 4 of them by starting next year will definitely, make the competition more exciting. But it boils down to one thing. It now gives the consumers, the Filipinos, more options. And I think the bottom line here is really on how to further promote inclusive digital finance.
Welcome back. You're still watching Industry Beacon here on BNC. Still with us, Clinique de Paris founder, managing director Ludovic Branellec, and its medical director, Dr. Rafael Fortus. During the quick break, we were talking about, before the quick break rather, we were talking about where you can implant hair follicles, right? You said it's popular here in the face and the eyebrows. I never knew that. But there's something very important. We were looking at some clips on air a while ago, and Ludo, you're telling me that you were shaving your head twice a week.
Exactly. Actually, every other day. So growing up, I knew that my father, my grandpa, my uncles were all receding. So I kind of grew up knowing that it was going to happen eventually. So
Right.
as soon as I started receding a bit, I went to shaving every other day and just accepting it. And I was a happily bald man. I was a minority.
But completely.
I had it completely, it was already gone on the side. So I
Right.
had a little island left here, which
Okay.
looked ridiculous whenever I started growing it out.
It's
So I
the
had to-
Rin Tin Tin
Exactly,
syndrome. Yeah,
exactly.
okay.
So I said, but I knew that the other techniques I would see would leave you a scar in the back
Right.
of the head. So I was like, I never really considered a hair transplant. And eventually I got convinced to give a try to the DHI technique. So after a lot of pressure, I decided to give in and I went through the procedure. And oh my God, that's when I realized how life-changing it was. The way people looked at me changed. People thought I was 10 years younger. They couldn't really put a finger on it, although it was pretty obvious. If you put my before and after photo, you can really see the difference. But people would just look at me and say, something changed. You look fresh. You look younger. Did
It
you?
was juicing.
Exactly. So I was like, wow, I didn't know that actually I was suffering in silence. I didn't know that deep inside it was something that bothered me. The mere fact that I felt forced to shave my head every other day just meant it's something I didn't
Yeah, and
accept.
I've known you for years, and I always know that you're a very confident individual. And this is quite shocking to me to
Exactly.
hear that you were suffering in silence.
Exactly.
And then obviously when your procedures worked, and now I didn't even know the difference, I have to tell you.
Exactly. Actually, even my barber can't tell the difference between the native hair and the implanted
Yeah.
hair. So that's what really convinced me that this is something different, something life-changing. And, that
And this
many
is
men-
why you created this business. or
Exactly.
invested
That's
in
what
this business.
convinced me to invest into this business with Doc Raf and bring this technology here to the Filipino people. Because we believe that Filipinos don't need to travel halfway to the world to get a procedure done in a different country where they don't obviously speak English that well, or
Yes.
we're not familiar with the Asian hair.
Right, right.
So we
That's
really
important.
tried to bring the technology here, train our doctors to actually handle Filipino Asian hair and hairlines. So
What about the stigmas? I mean, I'm sure our viewers are feeling different emotions just talking about this. What are the general stigmas that you
Well,
get?
the main misconceptions is that it's not permanent. But when you take the permanent healthy hairs from the back of the scalp and place them into the hairline, then they really do stay for the rest of your life. The other one is that it's very painful, but we use local anesthetic and we don't proceed until it's 0 out of 10.
What's a little bit of pain for beauty and confidence?
It's gone down, no? But at the same time, people are reassured because this is often the first time men take the opportunity to look after themselves. So we really have to make sure that they're well accommodated during the entire procedure.
Right. I know this is a business for the both of you, but is there a battle cry for Clinique de Paris when it comes to giving confidence back to individuals?
What we normally say is to do your research.
Right.
Make sure you speak to an expert that does this every single day. Once you have the best information, you can make the best decision for yourself. Yes, and our doctors are more than happy to assist in the Philippines. We want to make it accessible. Cosmetic surgery is normally reserved for the rich and the famous, but we want to make hair restoration and self-care available for all Filipinos, starting with preventative measures, the right advice, so that when and if they are ready for a hair transplant, they have the best opportunity and optimization.
It sounds like you're very busy in the clinic. How do people get into a schedule with you guys?
Well, we have our website and you
Yes.
can contact us there. It's cliniquedeparis.com.
Yes.
Or our socials as well.
Yes. What about? I've got a few questions here, and I wish we had a whole hour to discuss this. But you are part of the aesthetic industry in the Philippines. What's your take on the rise of aesthetic clinics in the Philippines? It's quite popular. It's the new luxury bag. It's the new diamond.
You know, during the pandemic, we thought that this was going to be a foreclosure, but actually people took the opportunity of a pandemic to give themselves permission to look after themselves and their health. I think in Asia, we're quite ahead of the rest of the world in terms of men and women looking after their skin and hair.
That's important. That's really important. I never thought about that. Why is that so?
I think in Asia, first impressions are really important.
So are we just vain?
I think it's more than a physical attribute. It connects us to each other, and the importance of quick interactions can really make the difference between, a deal or not.
Yes, especially in the business world, confidence is key. Although, the more successful businessmen that, run, multi-billion peso companies, they don't really care about how they look on the outside.
Absolutely.
But of course, when you're in the boardroom and you're talking to, your peers, and you see nice sets of heads, you're like,
right.
what's going on here? It kind of takes you back. You're like, okay, wait a minute. They have something I don't have,
That's
and
right.
and sometimes it does shake the equilibrium a tad. I mean, it's a fleeting question in their heads, but then, what am I going to do about it after the meeting, right?
Exactly. And at the same time, we're not trying to conform to a standard of beauty at all.
Yes.
It's really about bringing patients back to their former glory and to access the inner confidence that they really had themselves.
Right, because, in Asia, I would say, the Philippines, there's always a shroud of secrecy with, let's say, aesthetic enhancements. It's been done. You just don't talk about it, or you gossip about it, right? Is this changing? Because maybe that's a fear with patients, and if I'm going to go in, somebody's going to find out about this, and therefore I'm going to be embarrassed. Is that still an issue?
I think this is really changing nowadays, and people are proud to say that, I've taken measures, I've taken the right measures to address this hair loss and to age gracefully. And I guess this is really something people are happy to share. We have some brand ambassadors that are happy to share their journey with other people they know that are suffering in silence. And what really brings us the most pride is to know that about a third of our patients are actually foreigners who travel all the way from sometimes the other side of the world for the first time in Asia or the Philippines just to see the people in our clinic.
Sorry, Ludo, to cut you off. Yes. You said, some of your ambassadors. I want to hear testimonies. Just what's the most touching testimonial you've ever had from a patient? You choose one and you choose one. You first, Ludo.
I would say would be a 21-year-old. He's not an artista or anything. It was just a 21-year-old student who came in with his cap on with both his parents. That was his graduation present, his hair transplant.
Cool.
And when he came for his assessment, he had to take off his cap and show his hair to his parents who were in the same room. And they all started crying. It was the first time they'd seen him without a cap on. His own parents, he lived with them for 4 or 5 years. So everyone got very emotional in the room. He had, of course, a lot of confidence issues just in his body language, the way he spoke. And after his DHI, 6 months after, we saw him come back to the clinic. His whole demeanor, the way he walked, the way he talked, had completely changed, was a different person. Nice. And he was saying, I just got a girlfriend, I went on a date. So that really brought us so much joy. And to see the parents with tears of joy in their eyes, made us feel like we were doing the right thing.
Of course. What about you, Dr. Raf?
We see patients typically in their 30s and 40s, and sometimes at the point of their lives where they're finishing a marriage and they really want to start to do something for themselves. So, a divorcee who really thought that the 40s was the end of his peak years can really have a new lease on life. So this is the first time they did something for themselves, invested in quality care for themselves. So it's really rewarding again for us to see that.
Nice. Last question for each of you. What's your biggest mistake, Ludo?
The biggest mistake probably I've done is not doing anything about my hair loss earlier. I waited until I was 35 years old to do something about it. I wish I did it when I was 25, when I started losing my hair. Because all the people that knew me back then, when they see me now, they're like, you did something.
They're going to go buy you a drink.
Exactly.
What about you?
And me, maybe not starting the business earlier here in the Philippines. It's such a good opportunity to come from Australia here to the Philippines, start something together, and really put the Philippines on the map as something world-class.
Okay, thank you so much for joining me this morning. I really wish this was a whole hour, but that's it for today's show. I'm Ferdy Salvador. Catch the Billionaire News channel on Free TV channel 31 and on cable via Signal channel 24. Thank you for watching the Billionaire News channel, always on top.